Bismillahirrahmanirrahim. Assalamu alaikum to all the viewers of Channel 44, and I wish you all Ramadan Kareem. Thank you PMASA and thank you Human Appeal for the opportunity. My name is Kashif Khokhar. I'm one of the cardiologists based in Adelaide. I've been asked to talk about syncope, which is one of the common medical presentation we see, especially in the emergency department we call ER. Now, syncope can be a symptom of a very significant malignant underlying cardiac disease, or can be a very benign thing like a vasovagal syncope or simple faint, as people usually know it. So it's a whole spectrum. So I'll try to cover the simple faint first, and what are things to look for, and how we can help friends or families or any bystander, how it can get the appropriate help at the time when someone is passing out. So syncope is a transient loss of consciousness from which a person recovers very quickly. Usually the things to look for to make sure when you're approaching that kind of person, make sure the environment is safe, and once you approach it, try to lie him down in a left lateral position. So if they throw anything up, especially their lungs coming from the tummy, then it won't go into the lungs or aspirate. Now, what the person feels like symptoms-wise, which can result in syncope. So the symptoms, sinister symptoms to look for, if someone has chest discomfort, or if they feel their heart is really racing just prior to passing out, then those can be sinister symptoms, especially in the age group which is 50 and above, with the previous heart attack history, previous stroke history. If they have high blood pressure, they have diabetes. And this can be common in patients who are observing Ramadan or having a fast. And imagine if they're relatively dehydrated, a diabetic patient, or have a high blood pressure with previous history of heart attack or stroke, and suddenly they start having palpitation or chest pain, and then they pass out. So that's the medical emergency. In that situation, if you know to lie the patient in the left lateral position, then please do. If someone knows the CPR, so feel the pulse of the patient, and perform the appropriate interventions. And the most important thing is call for help. Call 999 or 111 or 111 or 222, whichever area you are, you can ask for help accordingly. The other kind of benign syncope or benign loss of consciousness is common in younger age group, especially in females. When you're standing for longer hours, you do feel dizzy, especially when you're dehydrated and when you're observing Ramadan and your rosa. And in that situation, ideally, these are the warning signs that the brain is not getting enough blood flow. Because imagine if you're standing for longer hours, a bit dehydrated, the blood starts pooling down into your legs. So brain is not getting enough blood flow. When it starts getting less attention, it starts crying. It starts saying, look, I'm not happy. Lie down quickly, raise your legs, and it will pass. So people who have syncopes in the past, they know these symptoms, they acknowledge and recognize those symptoms, and they act accordingly. The most common mistake people do, they get up very quickly. So if you have this kind of symptom when your blood is kind of pooling into your legs, you're feeling tunnel vision, bit of chest pain, palpitations, feeling something is going wrong, and you're about to pass out, lie down, raise your legs, and wait for at least 3 to 5 minutes. Try not to get up very quickly. Usually the bystander or your family or friends, you will say, oh, your face was looking like paper white. So this is again one of those common scenarios you come up with, and usually this is a benign thing until unless someone have a family history of dying suddenly in younger age group, less than 50, or if they have a structural heart disease. So syncope is a symptom, and it has to be taken in context of the history and examination, and especially including the family history. The benign kind of symptoms or the simple faints, again, people will lie down, raise their legs. If they are not observing fast, they can have some water or fluid intake, and that usually helps. If you're observing fast and you start feeling better after 5 to 10 minutes, you can continue observing fast. And as per my knowledge, if someone slightly have a nausea or a bit of a slight vomiting in that scenario and they haven't aspirated, I think the fast will continue. But if you're feeling unwell, ask for medical help, call the ambulance if you have to come to the hospital, and take things accordingly.